Chapter 13, Non-Blood Specimens and Tests. So go ahead and review the objectives, as always, for this chapter. Remembering you can pause at any time. Alright, non-blood specimen labeling and handling. Labeling should include type and or source of specimen. Should be labeled with the same ID info as blood specimens. Urine is the most frequently analyzed non-blood body fluid. Several of the things it can analyze are listed below. Accurate results from urine depend on collection method, container use, specimen transportation and handling, and timeliness of testing. Specimen collection is typically handled by nurses, and phlebotomists can do it for outpatient. Common urine tests. The routine urinalysis, most commonly requested urine test. Culture and sensitivity, ordered for patients with symptoms of a urinary tract infection. Urine specimens collected in sterile containers for CNS testing. For culture and sensitivity, the container does need to be sterile. Urine cytology studies for detecting cancer, cytomegalovirus, and other diseases. The urine drug screen, performed to detect illicit use of recreational drugs, anabolic steroids, and unwarranted use of prescription drugs. Urine glucose and ketone testing to screen for diabetes and monitor glucose and ketone levels in diabetics. The urine pregnancy test, testing for HCG in the urine. And then there's some other several urine tests listed below. Types of urine specimens. There are several. There's a random, collected at any time. First morning, collected on waking after 8 hours of sleep. Fasting, and timed, collected at specific times. Tolerance test for the 2-hour postprandial, 24-hour double voided. 24-hour urine collection procedure. Make sure you are familiar with this procedure. There are several kinds of methods for collecting. There's the regular voided, a midstream clean catch, catheterized, suprapubic aspiration, and pediatric. Make sure you're familiar with each one of those. Amniotic fluid is the clear fluid that fills the membrane surrounding and cushioning the fetus. Collected after 15 weeks of gestation, and it's analyzed to detect genetic disorders and problems in fetal development. Cerebral spinal fluid, or CSF, the clear colorless liquid that surrounds the brain and the spinal cord. Specimens are obtained by a physician, used to diagnose meningitis, brain abscess, CNS cancer, multiple sclerosis. Routine tests include cell counts, chloride, glucose, total protein, and CSF culture, as well as the gram stain. Gastric fluid, gastric analysis, examines stomach contents for abnormal substances. Nasopharyngeal secretions from the nasal cavity and the pharynx. Culture to detect presence of microorganisms causing diphtheria, meningitis, pertussis, and pneumonia. Using a sterile Dacron or cotton-tipped flexible wire swab. Not the red swabs that you use for cultures. Saliva. Obviously, fluid secreted by the glands in mouth. Used to monitor hormone levels, detect alcohol and drug abuse. Semen. Sperm-containing fluid discharged during male ejaculation. Used to assess fertility or effectiveness of sterilization. Can be used for criminal sexual investigations. Needs to be kept in sterile containers, warm and protected from light. Serous fluid is found between the double-layered membranes enclosing the pleural, pericardial, and peritoneal cavities. These include pleural fluid in the lungs, peritoneal fluid in the abdominal cavity, and pericardial fluid in the heart. Sputum, the mucus or phlegm ejected from the trachea, bronchi, and lungs. Used to diagnose lower respiratory tract infections. This is a sputum specimen container, an example of. Sweat, analyzed for chloride content and diagnosis of cystic fibrosis. Synovial fluid, the clear pale yellow viscous fluid that lubricates movable joints. Increases when inflammation is present, can be tested to identify or differentiate arthritis, gout, and other inflammatory conditions. Buccal or cheek swabs, used to obtain cells for DNA analysis. Bone marrow, aspirated and examined to detect and identify blood diseases. The physician will collect this using a large needle into the hip. Breath samples. C-urea breath test is used to detect H. pylori. And hydrogen breath test. Feces or stool, useful in evaluation of gastrointestinal disorders. They can be used to evaluate for presence of intestinal parasites and their eggs. Checked for fat and urobilinogen. Cultured to detect presence of pathogenic bacteria and viruses. And tested for the presence of occult blood using the Guaiac test. Hair, collected for trace and heavy metal analysis and detection of drugs. Throat swabs, collected to aid in the diagnosis of streptococcal infections. These are the red swabs. You can use these for streptococcal checking, but you do not use these for like the nasopharyngeal that we mentioned earlier. Those are green-handled swabs. Okay, so this is the procedure for collecting throat specimens. Again, most of you will never do this in your job. Most of the time this is done by a nurse. But go ahead and be familiar with it. And finally, tissue specimens collected by biopsy, which is the removal of tissue for examination.